Welcome back to Section 5 of our course, Understanding Mental Health, a WHO Mental Health Gap Action Program, inspired course for non-specialists. In our last lesson, we explored how to build social support networks and create community-based interventions for individuals struggling with depression. We learned that providing a strong support system and connecting people with local resources can make a significant difference in their recovery. Now, we turn our attention to acute depression episodes when someone's symptoms become so severe that they may be at risk of harming themselves or others. In this lesson, we'll discuss how to manage a crisis, whether that means responding to thoughts of suicide, helping someone in deep emotional pain, or keeping them safe until they can get professional care. What is an acute depression episode? An acute depression episode refers to a severe worsening of depressive symptoms. During these episodes, someone may experience intense feelings of hopelessness, extreme fatigue, and a lack of control over their emotions or actions. They may also experience suicidal thoughts or self-harm urges, which require immediate attention and support. These episodes are often triggered by life stressors, such as the loss of a loved one, a major life change, or overwhelming ongoing challenges. While these episodes can be incredibly distressing, it's important to remain calm, focused, and compassionate when responding to someone in crisis. How to manage an acute depression episode. Let's look at how to respond when someone is experiencing an acute depression episode. 1. Stay calm and present. The first and most important step is to remain calm. When someone is in emotional crisis, they often need a steady presence. If you panic, the person may feel more anxious or overwhelmed. Speak slowly and softly. Offer them assurance. I'm here for you. You're not alone. Listen actively. Don't interrupt. Allow them to express what they're feeling. By staying calm, you help the person feel more secure and supported. 2. Assess the situation. Next, it's important to assess whether the person is at risk of harming themselves or others. Ask direct but gentle questions about their thoughts. For example, are you thinking about hurting yourself? Have you had any thoughts about ending your life? Don't be afraid to ask directly. Research shows that asking about suicide does not make the situation worse. It actually opens the door for the person to talk openly about their feelings. If the person expresses suicidal ideation or mentions self-harm, it's essential to take immediate action. 3. Ensure their safety. If the person is at immediate risk of harming themselves or others, your priority is to ensure their safety. Here are steps you can take. Stay with them. Never leave someone alone if they are suicidal or at high risk. Remove any potential dangers. If the person has access to sharp objects, medications, or firearms, remove them from the environment. Stay supportive. Continue speaking calmly, reassuring them that help is available and that they don't have to go through this alone. If the person is in a public space, try to move them to a safer, quieter environment. 4. Get professional help. It's essential to connect the person with professional care as soon as possible. You are not expected to handle the entire crisis on your own. Your role is to provide immediate support and make sure they are safe until help arrives. Call for help. Contact a mental health professional, emergency services, or a crisis helpline. Stay with the person until help arrives, offering comfort and encouragement. If possible, accompany them to the health facility or support them in contacting their healthcare provider. Let's pause for a moment of reflection. Imagine a scenario where you are the first person to respond to someone in crisis. How would you handle the situation? What steps would you take to ensure their safety and well-being while maintaining a calm, supportive presence? In a crisis, staying composed and focused can make a significant difference. A real-world example, John, a 28-year-old man from Akwa Ibom, has been struggling with severe depression after the loss of his job. One evening, he tells his friend that he feels like there's no point in living anymore and doesn't want to go on. His friend, a trained community volunteer, responds by staying calm and reassuring John that he's not alone, asking direct questions. "John, are you thinking of hurting yourself right now?" John admits he's been planning suicide, ensuring his safety. The friend removes any potential items that could be used for harm and stays with him, speaking softly and offering emotional support. Contacting professional help. The friend calls a local mental health center and arranges for John to be seen by a counselor immediately. John receives the care he needs, and his friend's calm, compassionate response helps save his life. In summary, crisis management for acute depression episodes involves staying calm, assessing the risk, ensuring safety, and getting professional help. Ask direct, gentle questions about suicidal thoughts or self-harm. Remove immediate risks and stay with the person until they are safe. Connect the person to professional care, whether that's a helpline, healthcare provider, or mental health facility. In our next lesson, we'll explore referral and coordination of care, how to connect individuals with the appropriate resources, and ensure they receive the right support. Before we continue, here's your final reflection for today. If someone confided in you about their depression and suicidal thoughts, how would you handle the situation? What immediate steps could you take to ensure they get the help they need? Let's continue to learn and build our ability to provide compassionate, effective care in these critical moments.